Today in HealthView, in vitro fertilization has enabled millions of women to become pregnant when they would not have had that chance otherwise. But a new study involving in vitro and birth defects has many women a little concerned. Dr. Kaylen Silverberg is with the Texas Fertility Center with information on what this study really means. Good to see you.
Thank you.
So tell us what this study looked at and what the results were.
Well, the study looked at women who went through in vitro fertilization. The headline is they looked at 300,000 babies that were born, but only 2,000 were from in vitro fertilization. And of those, very few needed injection of sperm into the eggs. They had a little bit of an increased risk of problems with their babies. Women who didn't need injection had no increased risk.
So basically, some women are interpreting that as in vitro increases the risk that you might have birth defects in your children?
Yeah, but that's the misinterpretation, because women who didn't need sperm injection did not have an increased risk of birth defects.
Basically, what you've been talking about is the fact that women who have issues conceiving, men who have issues with conception, oftentimes are at a higher risk for birth defects.
In general, they are. So women who have problems with infertility have an increased risk of having a baby with some kind of an abnormality. And to put it in perspective, that risk is very small. There's also a very large study that was previously published looking at 135,000 babies born from in vitro fertilization that actually showed that babies that were born from IVF had a reduced risk of having a problem. So not only was their risk the same as nature or higher, it was none of those, it was actually lower, 1/3 to 2/3 lower than nature. And that was a study of 135,000 babies born from IVF. This study, even though the headline number was 300,000 babies born, only less than 2,000 required in vitro fertilization. So it's a much, much smaller study.
So what do you say to women, to couples who are considering this?
Sure. We tell couples that the basic risk, once you're infertile, once you've had a problem conceiving, your basic risk of having a baby with a problem is minimally elevated over couples who've never had a problem. And only with the most advanced, most aggressive forms of treatment that we only use when there's already a significant underlying problem does that risk increase further. And even then, it's a minimal increased risk over nature alone.
Doctor, thank you so much for clearing up some of the misconceptions. I appreciate it.
Thanks so much for having me.
And for more information about infertility treatments and IVF, you can go to KVUE.com. We have a link to the Texas Fertility Center where you can find out much, much more.